Right now I'm recording myself doing 2 occlusal sealants for tooth number 30 and tooth number 14. Fully erupted permanent molars with deep pits and fissures, IC DOS 0 to 3, free of any carious lesions. I have current useful radiographs to show no proximal carious lesions. The ISO dry is required for this procedure. I gathered the proper armamentarium. This includes the curing light, orange shield, prophylactic brush, pumice, acid etch, dry triangles, cotton roll holders, cotton forceps, HVE suction, sealant material and applicator, articulating paper, floss, and a scaler. Now I'm going to verbalize the surface to be to the faculty. Work on tooth number 30, IC DOS 1, and to be treated will be the occlusal is 1, and the surface to be treated will be the occlusal surface. The ISO dry is well fitted in the patient's mouth. I'm going to cleanse the tooth surface with a Profi brush and pumice, and then after that I'm going to thoroughly rinse the cleansing agent, isolate, and dry the tooth surface. So now we're working on tooth number 30. Okay, now I'm going to rinse and thoroughly dry the area. Okay, I'm going to dry the area with air, and it's still suctioning everything. I have 2 dry cotton rolls in the cotton roll holders. I'm just going to place them right here, right before I apply the acid etch. Just like that. But because I don't have the holders, I can't demonstrate this part. Now I can also apply the dry angle right here, right by the gland, so that we can keep the area dry. So now I'm going to apply the phosphoric acid etch conditioner to all surfaces being sealed according to the manufacturer's direction. I'm not going to apply too much. I just want to apply it to the areas where I will be where they'll be sealing, because you don't want to demineralize too much of the tooth. All right, I'm going to apply it now. Just a little, like just enough for the area where it will be sealed. The pits and the just like that. And then I'm going to wait 1 to 2 minutes, and then I'm going to rinse the acid etch thoroughly for 30 to 60 seconds. Right, I want to make sure I have 2 new dry cotton rolls, just to keep the tooth isolated and dry, just like that with the cotton roll holders. And then right now I'm going to apply my sealant material. And you want to make sure to just apply a small amount into the grooves. So I'm starting on this end because that means the sealant material can drip, it can move downwards. Just like that, very little. And then I will use a micro brush applicator, and then I will use a dabbing motion to remove any excess sealant material. And I want to avoid removing too much of the material. And then that way, you want to avoid removing too much of the material because not much will be sealed. So make sure to use the dabbing motion instead of a wiping motion for any excess sealant material. And you want to avoid overfilling the fissures. All right, right now you can adjust the overhead light setting, and then you can use this orange shield for eye protection. You want to make sure you're establishing a stable fulcrum. So I would probably fulcrum, I would be closer to the, hold it like this, and then I will use my ring finger and fulcrum maybe to a few tooth next to it, just like that. And you want to keep the light 1 to 2 millimeters above the sealing surface, and you can use your non-dominant hand to press the button. You want to cure according to the manufacturer's recommendation to ensure polymerization. So after curing, you want to wipe the surface with a wet cotton roll. So we're going to cure this tooth, and you want to press the button 2 times and wait the full 30 seconds. So each one will be 15 seconds, each click. Okay, now I'm done with that. I'm going to wet my gauze and wipe the area. this is a wet gauze. I'm going to make sure I change the light setting, the overhead light, because now we're not curing. I'm just wiping the surface. And then now you want to check for any voids in the surface to make sure that it's a successful bond to the tooth. So I will use my 3A Explorer to check for any voids. And then you also want to floss in between, like to make sure the contacts are open. If they're closed, you want to make sure the contacts are open before you dismiss the patient. All right. Now I'm going to evaluate the patient occlusion with articulating paper. So I'm just going to use the 4 steps. And then I'm going to place it here and have the patient bite a few times. Maybe I'm going to hold it like that so the patient can bite. They're going to chomp on it a few times, and then we're going to check the occlusion. And then if there are black areas, we want to smooth that area so there are no high areas. And we can use the universal correct scaler, and you want to scale so that there are no high areas. You want to smooth out any of the high areas. And then check the occlusion again. Check the occlusion again. They're going to bite a few times, and then it looks good. And then after the instructor's checks, then we can apply fluoride varnish to the surface, and then we want to document the procedure in the treatment history and include the tooth number and surfaces, the etching and the sealant materials, and the fluoride used. Right now, I'm going to make sure the IsoDry is well fitted in the patient's mouth. I'm going to verbalize the IC DOS and the surface to be treated. And so the IC DOS for tooth number 14, occlusal, is 1. I want to make sure I'm cleaning the tooth surface with a prophy brush and pumice. And then after that, I'm going to thoroughly rinse the cleansing agent, isolate and dry the tooth surface. Okay, so then now I'm going to make sure I have a fulcrum. So we're going to do tooth number 14 right here. So I'm going to have a fulcrum here. Okay, I'm going to rinse. And dry the area. Isolate and dry the area. So 2 dry cotton rolls, just right here like that, and then there will be a holder to hold it in place. And I can use a dry angle as well. Okay, right now I'm going to apply the phosphoric acid etch. You just want to apply it to the surfaces that will be sealed, and avoid applying too much because then it will demineralize more of the enamel surface. So I'm going to start right here, just a little bit. So this is the area that will be sealed. Then you want to wait 1 to 2 minutes, and then rinse off. Now I'm going to rinse off the acid etch thoroughly for 30 to 60 seconds. And then after rinsing, so I'm going to rinse for 30 to 60 seconds. After that, you want to isolate and dry the tooth surface and maintain isolation with mirror or fingers. Okay, and now I'm going to isolate the area. So I have 2 dry cotton rolls in the cotton holder. I'm just going to isolate the area like that. And then I'm going to assess for a chalky white appearance on the areas to be sealed. Okay, I'm gonna make the cotton rolls will still be here. I just can't demo it because I don't have the holders. And then now I'm going to apply the sealant materials. Okay, now I'm going to apply the sealant material, and I'm going to move it into the grooves. And I don't want to apply too much because a little goes a long way. And you want to start right here because it will. You want to start here because then the sealant material can flow downwards, just like that. And you want to use a micro brush. You want to use a micro brush to dab away. You want to dab away any of the excess sealant material, and you want to avoid using this wiping motion. So instead, you just want to dab it, and you want to avoid overfilling the fissures as well. Now you want to adjust the overhead lighting because now it's time to cure the sealant. So I'm going to hold it like this. That way I can have a fulcrum right there. And you want to use your non-dominant hand to press the button. So you want to press the button twice. Each time it will be 15 seconds. You want a total of 30 seconds. After you're done curing, you want to wipe the surface with a wet gauze. So I have a wet gauze here, and I'm just going to wipe the surface. And I'm going to instruct the patient to rinse with warm water for 30 seconds. Now I'm going to check for any voids in the surface just so that we have a successful bond to the tooth. So to do that, I'm going to use my 3A Explorer. So my 3A Explorer, I'm checking for any voids. And then I'm going to floss. I'm going to floss to make sure that there are open contacts. And you want to make sure not to, if they're closed, you want to make sure the contacts are open before you dismiss the patient. And you want to check, now you want to check for occlusion. So what I do is I'm going to check for occlusion right here and have the patient chomp on this articulating paper a few times. And then I'll smooth out any high areas as needed with a scaler or universal current. And then now I'm going to have the instructor check. And once everything, the occlusion is good and there are no high areas, I'm going to apply fluoride varnish to the surface. And I want to document the procedure in the treatment history. And I will include the tooth number, surfaces, and etching sealant material, and the fluoride used. So the whole time I'm going to keep my tray very clean and neat. And then deglove and glove when necessary.